All right, so we're here. We're gonna do Morpheus8 on the face and neck today. So our lovely patient has been numbing for actually an hour and a half. She's doing great. She can already feel it starting to set up. So what we usually do to make sure everybody's good and comfy is do the hour and a half with that topical numbing. And then I just take it off one area at a time. So she's still numbing in the rest. And we'll take this off. And then I actually do a nerve block on top of this in each section as we go along. So what we'll do here, we'll first clean her and get this all cleaned off. Well, she came straight from work maybe. The full face of makeup. So clean it all off with just a little alcohol. And this is her second session, and she is already getting compliments from her first session. That was, I think, about 5 weeks ago. So we're very happy with the results that she's gotten. So we'll do, and this is arguably the most uncomfortable part when we just do this little nerve block. So I'm gonna make sure she's getting clean here. So we're gonna do the supratrochlear and the supraocular nerve. So already a little pinch, and we just do them in one pinch together. Pinch. Sorry. Pinch. A little burning. And this is lidocaine as it goes in. It's always just a little bit pinchy, but it makes everything so much more comfortable. So we just do that. We do that on both sides. Little one here, little pinch. Wonderful. She's doing awesome. She's gonna be so thankful she has this, because then she's not gonna feel a thing. Great. I'm actually just gonna clean her off because she had so much makeup on. Clean her off one more time with a little bit more alcohol. And can you feel that block kind of traveling up?
Oh, yes.
People can feel that after we inject it. They can feel it kind of traveling up the forehead. It's pretty fun. And then we'll do her first one and kind of test it out and see how it feels. I always go a little deeper first, because the deeper ones are not as uncomfortable actually as the shallow ones. So we start with those first and see how she does. And I just do single stack on the forehead. So let's try your first one here. Make sure we don't get any hairs in there. Ready? Maybe if I can find the petal. How's that?
Good.
You feel it? Wonderful. Easy peasy. So we'll just go across her whole forehead, and then we'll show you the rest of the face in a minute. So we already did her forehead. She did great. She could barely feel anything. We're going to do a few more injections for the face. So I'll have you turn. So we do one here, preauricular, and I did clean her off already. I took all the numbing off and cleaned her off. And these are all just a little bit pinchy. Ready? A little pinch. Ready? Pinch, pinch. A little numbing. This is the necessary evil. She'll tell you that this is probably the worst part of the whole thing.
And actually, that's not as bad.
Perfect. A little pinch there. Pinch. Pinch, pinch. Beautiful. And then we do here, I go a third of the way in between to get that buccal nerve. Little pinch. Pinch, pinch, pinch. She's doing great. And I just do a half to 1 cc in every area, just to try to kind of cover the nerve. And then I do a dental block, because around the mouth is so sensitive. So if you can open for me a little bit. And I go on the inside, get the mental nerve here, a little pinch. Sorry. Pinch, pinch, pinch. Okay, and then we do one more up here. Do the infraorbital, little pinch, ready, pinch. Okay, she's doing great. And this one can sometimes make her on the eye numb. It definitely makes her on the mouth numb. She's doing awesome. And that's it. And she's gonna be good and numb on that side. And we'll start around the mouth since that's always more sensitive and we don't want it to wear off. So go ahead and roll your lips together for me, please, if you would.
Together?
Yeah, if you can feel them. Can you feel them?
Barely.
Wonderful. Ready? She felt it just a smidge. It would be a lot more uncomfortable without any nerve block. Ready? Great. I'm going to go down below it. Oh, she's really numb there. Good. And then we'll start doing some triple stacking. And she's gonna do fantastic. We're gonna get so many pulses with her. She's gonna be so happy. All right, so we just finished the face. She did great. A little bit of pinpoint bleeding like this is normal. And we're gonna do her neck too, but while we're doing her neck, we're just gonna cool down her face. It feels like she's got a little bit of a sunburn. So we're just gonna put this mask on for a little bit, give her a little bit of relief. And then before she goes, we're gonna put some stem cell cream on. Can you lift your head up just a little bit? We're just gonna kind of go. Is that okay? Is that too tight?
No, that's good.
Do you want this one down below or is that okay?
That's good.
Okay. So we'll just do that. And since we're here already, I'll show you. So we took the numbing, the topical numbing off her neck. And then I'm going to do an injection in her neck, kind of like we did for the face. So turn away from me. Wonderful. And lift your head up off the table. Yep, and that's just to get my landmark so you can put it back down. Relax it. So I'm gonna go right behind the muscle here, a little pinch, pinch. And aspirate, make sure we're not in any vessel. And then I just get the cervical plexus as it comes out here. And so that'll give it a really nice, comfortable procedure, and we'll do that on both sides. But that'll be a good start on that side. And she did fantastic with the neck. We got 900 pulses on her neck, which is going to give us fabulous results. And let's see how we do down here. Now that we're good and numb, we're all set up. We're at 3 millimeters and 30 joules. How's that feel?
Good.
Awesome. All right. Thanks.